There are 6 pills sitting in millions of American medicine cabinets right now that, when taken every day for years, are quietly raising the risk of dementia, falls, hip fractures, kidney damage, and early death in adults over 50. These aren't street drugs. These aren't supplements from a sketchy website. These are medications prescribed by trusted doctors for ordinary problems: heartburn, anxiety, trouble sleeping, and overactive bladder. The kind of pills nobody questions because they came from a pharmacy with insurance covering the cost. The problem isn't the pills themselves. Each one of these medications has a real purpose and helps real patients. The problem is duration. They were designed for short-term use, 2 to 4 weeks in most cases. Millions of people have been taking them for years. The harms only show up after extended exposure, which means by the time anyone connects the dots, the damage is already done. I'm Dr. Gray. Let me walk you through the 6 pills you need to look at carefully if any of them are in your daily routine, and what to do if you find your name on this list. Pill 1. Heartburn medications called PP. The most common ones are omeprazole, esomeprazole, and lansoprazole. The brand names are Prilosec, Nexium, and Prevacid. If you take a heartburn pill every morning, it's almost certainly one of these. PPs were originally approved for short courses, 4 to 12 weeks at a time. Between 2000 and 2018, in one Canadian province alone, the use of these drugs went up 257%. Most patients prescribed a PP never come off it. About 62% of older adults on these medications have been taking them for more than 2 years. 42% have been on them for over 5. Long-term PPI use is now linked to chronic kidney disease, vitamin B12 deficiency that mimics dementia, low magnesium levels that can trigger irregular heart rhythms, hip and spine fractures, an increased risk of pneumonia, and a documented association with dementia itself. The mechanism is straightforward. Your stomach acid serves a purpose. It breaks down food, absorbs minerals, and kills bacteria that come in through your mouth. When you shut that acid down for years, all of those functions degrade. If you've been taking a PPI daily for more than 3 months, ask your doctor about tapering off. Many people can transition to a less aggressive medication called an H2 blocker, or manage symptoms with diet changes alone. Stopping a PPI cold turkey causes acid rebound, so the taper has to be done gradually, but it can be done. Pill 2. Anxiety and sleep medications called benzodiazepines. The common ones are alprazolam, lorazepam, and diazepam. You know them as Xanax, Ativan, and Valium. There's also a related class called Z drugs that includes zolpidem, sold as Ambien. International guidelines have recommended limiting benzodiazepine use to 4 weeks maximum since the 1980s. Despite that, long-term use among older adults has steadily increased, not decreased. Many patients have been on these pills daily for decades. The harms in older adults are well documented. Benzodiazepines slow reaction time, impair balance, and significantly raise the risk of falls. And a fall in someone over 70 frequently leads to a hip fracture, which carries a 1-year mortality rate of roughly 20 to 30%. These drugs also cause measurable cognitive decline with long-term use, and several studies have linked them to a higher risk of developing dementia. Stopping benzodiazepines is harder than stopping a PPI. Going off them suddenly can cause seizures and severe withdrawal. If you've been on one of these daily for more than a month, do not stop on your own. Talk to your doctor about a slow, supervised taper. The drug took you down gradually. Coming off needs to be just as gradual. Pill 3. Sleep aids containing diphenhydramine. This is the active ingredient in Benadryl, ZQuil, Tylenol PM, Advil PM, Unisom, and dozens of other over-the-counter sleep products marketed directly to seniors. It's been around for decades. It's sold without a prescription, and most people assume that means it's safe. It isn't safe for daily use after 50, and the reason has nothing to do with allergies. Diphenhydramine belongs to a class of drugs called anticholinergics, which block a neurotransmitter your brain uses for memory and learning. A landmark 2015 study followed over 3,000 adults aged 65 and older for 7 years. Participants who took anticholinergic medications regularly had a significantly higher risk of developing dementia. The more they took, the higher the risk climbed. Diphenhydramine sits at the top of the anticholinergic burden list. The American Geriatric Society has explicitly recommended against its use in older adults for years. And yet, it's still the active ingredient in nearly every PM sleep product sold in pharmacies. If you've been reaching for Tylenol PM most nights to help you sleep, that's the habit to break first. Switch to non-drug strategies: cooler bedroom, no screens before bed, consistent wake time. If you genuinely need a sleep aid, ask your doctor about safer alternatives. Pill 4. Bladder control medications like oxybutynin. If you take a daily pill for an overactive bladder, there's a good chance it's oxybutynin, tolterodine, or solifenacin. Brand names include Ditropan, Detrol, and Vesicare. These medications belong to the same anticholinergic family as Benadryl. Same neurotransmitter blockade. Same risk profile for the brain. The 2015 dementia study covered these drugs alongside Benadryl. The Beers criteria, which lists medications that are potentially inappropriate for older adults, includes oxybutynin specifically as a drug to avoid when possible. Newer bladder medications called beta-3 agonists, such as mirabegron, work through a different mechanism that doesn't carry the cognitive risk. If you've been on oxybutynin for years, ask your doctor whether switching to a beta-3 agonist makes sense for you. The conversation costs nothing. The medication change could protect your brain over the next 2 decades. Pill 5. Antipsychotics prescribed off-label for sleep or agitation. This one is less common, but worth knowing about because the prescribing has quietly increased. Quetiapine, sold as Seroquel, is approved for schizophrenia and bipolar disorder. It's been increasingly prescribed in low doses to older adults for insomnia, anxiety, or agitation related to dementia, none of which are uses the FDA has approved. For older adults specifically, the FDA has issued a black box warning. Antipsychotics significantly increase the risk of death in elderly patients with dementia-related psychosis. They also cause weight gain, blood sugar elevation, and movement disorders, and they sedate the brain in ways that worsen cognitive function over time. If you or a family member is taking Seroquel as a sleep aid, that's an off-label use that deserves a hard look. The medication may have started for a legitimate short-term reason and never been reevaluated. The conversation to have is whether the original reason still applies and whether a safer option exists. Pill 6. Long-term opioid pain medications. The opioid story for younger adults is one most people have heard. For older adults, the picture looks different but no less serious. Hydrocodone, oxycodone, tramadol, and similar drugs prescribed for chronic back pain, joint pain, or post-surgical pain that never fully resolves are now taken daily by millions of people over 60. The risks compound differently in an older body. Opioids slow breathing during sleep, which is especially dangerous in people with undiagnosed sleep apnea. They impair balance and dramatically increase the risk of falls. They cause cognitive fog and memory problems. And tolerance builds steadily, meaning the dose required for the same pain relief keeps climbing while the side effects keep getting worse. If you've been on a daily opioid for chronic pain for over a year, ask your doctor whether the medication is still helping your function and not just dulling your awareness. Many patients on long-term opioids discover when they finally taper down that the pain wasn't actually being controlled and that their cognition and energy come back as the dose drops. The point of this video isn't to scare you off medications you legitimately need. Some patients require these drugs, and the benefit absolutely outweighs the risk. The point is that millions of people are taking them out of habit, not necessity, because the original reason for the prescription was resolved years ago, but nobody ever revisited the decision. At your next appointment, bring a complete list of every medication you take, including over-the-counter products. Ask your doctor to walk through each one with you. The specific question to ask is this: is this medication still serving its original purpose? And is the benefit still outweighing the risk at my age? A good doctor will welcome that question. A doctor who waves it away is a doctor worth replacing. Most of these medications can be safely reduced or stopped with a proper plan. None of them should be stopped on your own. The list of pills you swallow every morning shaped your health when you started taking them. It's quietly shaping it now, too. The 5 minutes it takes to review them could be the most valuable 5 minutes of your year.